It's a great pleasure to be here and to be able to introduce this topic of global health. What I'm going to try to do is to talk about its importance to neurosurgery and neurosurgery's unexpected importance in global humanitarianism. I'll use some personal examples, but I'll also begin to give an idea of what I think the present situation is and a path to the future. I'm happy to say that neurosurgery is now beginning to think globally. This may not be true of the rest of the country, but very much in neurosurgery it is. And it's very important because the worldwide disparities in medical care, which I grew up being told could only be addressed by internists or infectious disease doctors, are far greater in specialties like neurosurgery. On the left is my OR in Madison, on the right is an OR in South America. And this goes on and on and on. And I started with humanitarian neurosurgery 4 decades ago, working in the Appalachian region of the United States. I discovered the tremendous benefits to myself of doing this, the people I associated with, the work I did, and the service I did. But I was always concerned that it was falling short of lasting impact. And that's very important because 3 decades ago, I was asked to join Global Neurosurgery Group working in Guatemala. And that example really set the stage for a lot of what I will talk about. Tremendous personal fulfillment, but minimal lasting impact. I did, however, realize as I served that there are several lessons. One, these countries of the developing world are urbanizing. People are moving to the capital. 25 million in one city, the next largest city is 80,000. That means a complete disruption of the distal medical system, the regional distribution of food, transportation, patients. It's a big problem for healthcare. Second, disruption by civil war. Unfortunately, I was teaching during the time of the Guatemalan Civil War, a time of great difficulties, and your impact was always changed by a changeover in government or a threat to the people you educated. This became one of the lasting things. But during that time, I met this young lady, and this is the actual lady that changed my life. She's a small child in Guatemala selling fruit. I had seen over 100 patients that day. I was proud of myself, but I need not have been. And I saw her, and she was healthy. And I said, I won't be back to this city for a long time. Who will care for her when I'm not there? And then I began to stop and say, what do I really do well? And at that time, I realized 3 decades ago, I was good at training doctors, training surgeons. So I began to change my own philosophy toward training surgeons toward a self-sustaining system. And that meant moving to other countries which weren't beset by war. Because when you do that, you understand that training neurosurgeons takes resources, takes time, but that's the way we make a lasting impact. And it became very clear to me that I needed collaboration. I needed volunteers among that society that were invested in it succeeding. I needed a government that would succeed. I could not do it alone. And that was a big shift from my personal service and personal fulfillment to what impact was being done. And that led to understanding the issue. When you do not have a neurosurgeon in a country of 1 million or more, and that's 25 countries in the world, or you have some countries where one neurosurgeon serves 11 million people, it means you have no neurosurgery, which means you have no trauma system, which means you do not take full care of cancer. You do not take care of stroke in this modern world, and their trauma system collapses. Pediatric care for the congenital anomalies we care about collapses, and nothing progresses. Yet, when I began to understand that, the impact of even one neurosurgeon working in that country continuously could change everything. And that became really the epiphany. Because although I spent 3 decades preaching this, it became reality only 5 years ago when the LANCET Commission and World Bank studied this issue and said the essential surgeries of the world, the surgeries that will take a person and return them to health and productivity, are absent for 5 billion people in the world. And that access to essential surgery is as important a human right as access to water, freedom from war, or access to antibiotics. Because absent that, Do you have any idea how many people died of Ebola last year? About 1,800. Do you know how many people died because they did not have access to a...
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.